Taoiseach, recently the Minister for Health signed legislation to allow for the operation of the medicinal cannabis access programme on a pilot basis for 5 years. Unfortunately, Minister, for those with a licence for medicinal cannabis in Ireland, some of the families are still having to go through hoops in order to get reimbursed in relation to the prescription. Parents are exhausted caring for children with special and exceptional needs. There's one particular family now in Waterford, the Keogh family, that are really having to jump through hoops to try and get this payment made. And whereas we really welcome the fact that this access programme is up and running, there's still some teething problems, and I would appreciate if you could raise it with the Minister for Health.
David Cullinan, a similar question. Brief.
Just to reinforce the comments which have been made, and I think Deputy Kenny will be raising this as well. We've all been contacted by this family. A number of weeks ago, the Minister for Health was helpful with a different family in Waterford who had a very similar problem with getting the money back under the Compassionate Access Programme for their child. And these are children with severe epilepsy, where the consultants in the hospital in Waterford, as well as their GPs, are recommending cannabis-based oil treatment. They have to go to Holland and elsewhere to get the money, but they're not being reimbursed. The family last week is reimbursed. This family has not been. It's the Kehoe family, as Deputy Butler has said. And I would ask that the HSE would look at this in a compassionate way.
Deputy Kenny, it's the same issue.
We had some good news last week, finally, with the Medical Cannabis Access Programme. But this stems from a situation from the Primary Care Reimbursement Service. And I would say it's very arbitrary and at worst very invidious. I raised 2 families 2 weeks ago to the Taoiseach, the Kelly family and the Stevens family. And it was no coincidence that the next day they were reimbursed because they had to go forced to go public. Now, the situation with this family, they are obviously, there's a financial burden on the family. They can obviously afford in the short term, but they cannot afford in the long term for this child, Killian. So I think it's important that the government make an intervention in this.
Can I assure the Minister for Health to communicate with the 3 deputies?
I have to say I'd be concerned if families were getting the supports they need solely because individual families have had to go public and get people in this House to raise. Now, I'm not saying it doesn't happen, but it shouldn't happen like that. Right? And I think this access programme is very new. It's only a couple of weeks old. The guidelines are really only starting to be understood by families and doctors, quite frankly. And so there will, I'm sure, be initial issues that we need to address, perhaps politically. But what we want to try and get to is a point where families are getting the services and the supports and the access to the treatments that they need, without having to publicly appeal for support on it. And that's certainly what Minister Harris is working on. But I'll raise a particular issue.